The following portion of Daytime Tri-Cities is sponsored by ETSU Health. Once again, it is time to meet your provider with ETSU Health, and today I want to introduce you to Dr. Allison Powers. Good morning, doctor. How are you?
I'm doing well, thank you.
Let's talk about your specialty, family medicine. Tell us how you got involved in family medicine.
Sure. I grew up in a small town in Virginia, rural Virginia, and so that was the doctor I knew when I chose medicine, so I think that highly influenced me. And as I got into training, I think my passions within family medicine changed a bit, but still love taking care of patients of all ages and all conditions.
And you have some background in obstetrics as well.
I did a one-year fellowship out of residency, and I think my residency in family medicine was moderately, and had a moderate volume in obstetrics, so that's where I had a growing passion for that part of family medicine, and then chose to do an extra year of training in that.
Well, before we get into family medicine, let's talk about the very beginning. What led you to become a doctor when you were younger?
Sure. I'm probably on the scope of somebody who decided a bit later. I was in my latter years of university when I decided for sure to be on the pre-medicine track. So I thought I wanted to be a photojournalist and travel around the world and go to underserved areas and take pictures and write articles. And then I fell in love with chemistry and said, okay, there's needs in other parts of the country, other parts of the world rather, maybe I can use medicine to go those places and serve the poor. And
it's not every day you hear someone say they fell in love with chemistry.
I know. Yeah, I had some very good teachers who made it exciting. Yeah.
And that's part of your passion for this job too, is helping to teach those that are coming behind you.
That's exactly right. I couldn't imagine doing medicine without, being in an academic setting or having learners. It definitely makes it worthwhile for me.
And being here in this setting at ETSU and the Quillen College of Medicine, perfect for you, isn't it?
It's excellent. Yeah, that's why my husband and I chose to come here. Yeah.
Talk about, we were talking about family medicine. You're basically there from birth all the way through when you're talking about family medicine. You're there through joyous times from birth, but some challenging times as well.
That's right. And it's probably true of all medicine, nothing is joyous 100% of the time, and we get trained well. How to try to meet folks in their darkest times and help them understand bad news and walking through that to come out the other side with their choices honored and their wishes honored, and giving them the best quality of life they can have with what conditions they've come to acquire.
When we talk about family medicine, if you had to pick one, I know it's kind of like picking your favorite child. What is the one area within family medicine that your favorite to practice?
That is very difficult.
Yes.
That's very difficult to choose. I'd say when I think what brings a smile to my face or what I'd want to read articles about, I think that I had a great teacher once advise me to say, okay, when you're choosing your specialty, think about what you're going to want to research and study and become an expert at and read on. And I get most excited, I think, by mom and baby conditions and mom and baby care. So, women and children. But I do
prenatal
love
care.
Prenatal care, newborn, infant care.
That's your favorite. I like that. Talk to me what a typical day is like for you.
Oh my!
Or is there a typical day?
I'd say a typical week, maybe.
Okay, all right.
Because in academic medicine, you do a bit of everything. So on a given week, you might have several days or half days of precepting where you're working with the resident physicians and they're seeing patients and coming to you for guidance or just to run their plans by a supervisor. And so you get to learn with them and teach them and see many more patients that way. And then a few days a week I'll see my own patients in clinic, and always thinking about learning opportunities and pulling residents or students in when there's something interesting to see or an ultrasound to do or something hands-on. And then every 2 months or so, 6 to 8 weeks, we'll rotate through and cover the hospital service. So we have residents that are on their rotation taking care of patients in the hospital for acute medical conditions, and so we'll be the supervising doc for a week week by week, and so those weeks will round in the mornings and then be available for any new admissions and on call overnight. So,
what is and this may be my last question here, but when you meet a new patient, what's that one thing that you want to project with them, or you want to glean from them? I know that most successful people say listening is their best attribute. Is that the same for you?
It is probably the very best tool you have in your toolbox. Your patients are. I try to communicate that they're the boss of this encounter, of this visit, because it's their body, it's their life that we're talking about. So certainly trying to hear what they want out of their health and out of their visit.
All right, Dr. Allison Powers, thank you so much.
Yes, sir.
It is Meet Your Provider with Dr. Allison Powers. It's been a great conversation. I enjoyed it thoroughly. Hey, folks, we'll be doing this about twice a month. It is time to Meet Your Provider with ETSU Health. The preceding portion of Daytime Tri-Cities was sponsored by ETSU Health.